Okay, so thank you ever so much, everybody, for giving up your rainy Thursday night to join our very first early years safeguarding masterclass. This was put on again as direct result from feedback from early years providers, from the safeguarding masterclasses, and just from conversations we'd had. So welcome. Your mics, I think, should be turned off. Any chat, please, questions put in the chat bar, and between us all, we should be able to answer them sort of as we're going along. We are in the presence of greatness tonight, especially if Karen can get her microphone on. Sort of the other presenters, we've got public health here, we've got Susan Crawford-Laddo, Hayden, obviously, policy officer, and so everything that sort of we'll talk about tonight is relevant to the section 3 in the safeguarding statutory framework. It's feedback from inspections, and it is a masterclass. So, you know, sort of sit back, enjoy, and take away sort of everything. Oh, well done, Karen. She can hear now. That's a big few for us as well. So next slide, please. Yeah, just a bit of housekeeping, as I've said. So yeah, next slide. We just got a technical issue for some reason. I can't sort of like move the slides on tonight. So all our safeguarding masterclasses, all of them, are always recorded. So when it's done tonight, it will be recorded. It will be available on the website. I can also send it out as well, so you can share it later on with the rest of your staff. And also you will get the slides, and I know from the public health team they've got additional materials as well that will be come out to you as well. So next slide, please, Hayden. Okay, as I said, we've got feedback from the statutory duties, from the survey that we did. Karen is going to do on SUDI, and Ruth, and we've got Dora with us as well tonight. You probably remember Dora from the COVID days. So they're going to do a lovely presentation, and then Susan, last but certainly not least, Susan Crawford-Laddo, manager. So as I said, we're in the presence of greatness and under us with you. Next slide, please. So yeah, earlier safeguarding, it's our first ever masterclass. As I said, you know, the North Yorkshire Safeguarding Partnership, it is that partnership between the local authority, the police, and health, and so you, as part of you know, the local authority is part of North Yorkshire, you are part of, you know, the safeguarding partnership. So it is a two-way thing, you know, so we just want to acknowledge that, you know, this is the safeguarding partnership. As we were talking today, you know, you are the ears and eyes in your local community. You know, Karen's presentation about SUDI, you know, even though you may not have children in your setting that sort of take sleeps or anything, but you might have a child in your setting that might be living in a small house with siblings, with a new baby, with parents that smoke. You know, it's those wider responsibilities, knowing that child's background, you know, all of that the EYFS covers. So it's just sort of having that big, you know, that holistic view, really. So it's those wider safeguarding duties. Okay, so next slide, please, Hayden. Oh. Okay, so we did the survey, and again, it was. Again, this was Karen in her lead as chair of one of the groups, wanted that direct feedback from providers. So we thought, right, let's do a really quick survey. And yeah, we got 13% of the PVI. It was just to the PVIs. We got a response back from. The largest response was from Childminders. At the time we did it, we had 272 childminders registered, 147 day nurseries and 79 preschools. And like I say, it didn't go out to schools. I won't read all these stats because, like I say, you're going to get the slides, so you can read these. But it did give us a really good feel for actually, you know, sort of how the partnership can help support you in your role. And like I say, it's that two-way thing. So next slide, please. So one of the questions we asked is, what do you like on the partnership website? And again, you know, it was really good to hear that the 1 minute guides are really good. Again, we like that because we know that everything that's on the partnership website is as up to date as it possibly can be. And we know from settings that contact us that some settings are still using out-of-date things. They've got area prevention manager on, things, you know, information that was 5 years out of date. So please, you know, again, please, you know, use the information that's on the website. What can be improved on the website? Next slide, please. So this was a bit of a, you know, you said we've looked at it. Some of the things that was the feedback is that, you know, it was accessing the trainings too complicated. Please just go through to NYS. I mean, today, you know, the number is 01609 533 222. They will always help you get onto the courses. One of the biggest things is people not remembering to check out. For any training that's free, you don't need to check out the basket. So they'll help you. Safeguarding. All the online safeguarding is free on our safeguarding website. So there is a wealth of training that's free. And what I would strongly say is please access this, because the way I look at it is if I was still a leader and a manager in a setting, if I was paying 8, 9, 10 staff all to do FGM awareness, how much would that cost me as a manager? And this is all free, but also it's that investment in your staff, isn't it? So actually, you know, you're showing parents, you're showing Ofsted, it's your staff's knowledge. And when we come on to the outstanding results, it's about that strength of partnership, you know, amongst the staff team. But also, you know, it's that we know that sort of investment in your staff can help retention and recruitment. And we know that's a massive issue at the moment. Again, you know, what level of safeguarding do childminders need? You don't have to do, you know, to be compliant with Ofsted, you've got to know your safeguarding, you've got to know that section 3, you know, you've got to know, do the training, understand what you need to know and how to make referrals, because it's about you safeguarding children, not sort of doing it for Ofsted. And again, easier referral form. There's training there to help, free early help training. Again, that's early help do an awful lot of free training. We send out the calendar, but then also there's other specifics as well. The next early help and child protection referral dates are actually every month. So like the next one's the 2nd of November, then the 1st of December, the 12th of January. So, you know, they are every month. So again, please, you know, please use that. And there's also a 1 minute guide to support with that as well. So next slide, please. So easier access to contact numbers. I did do a list that went out in February's key messages. Key messages are always held on the CYPS website, so if you need to go back, they're just there. So that did go out, and I believe that they are up on the Safeguarding Partnership website as well. And clear labelling, and I know Hayden will address that sort of a little bit later on. And principal leaflets, which there are principal leaflets on the you know, the 1 minute guides and things, but as we've said, please bear in mind that they're only as good as the day you print them off, because you could do it today, it could change, you know, there's a report come out today that might affect, so please just make sure that they're up to date.
I would actually say, Helen, to be honest, we would prefer people didn't print them off and actually come to the website, because we've actually in the round of 1 minute guides as have been reviewed, removing the ability to download them as a print off for the exact reason of, as you've mentioned earlier on, that people will print it off and then will leave it, and it will be there maybe for 2 or 3 years. We might have gone through 2 or 3 different revisions in that time. So we'd rather people come back to the website. It'll be in the same place that they got it from to begin with, and that they access it from there.
Yeah, fabulous, thank you. Next slide, please. So what I did was I looked at we've had 8 inadequate and 8 requires improvement judgments from February till September, and I looked at all the reports and pulled out where and how it related to the statutory framework. Overwhelmingly, and these are in order, overwhelmingly 3.6 came out as being picked up by Ofsted, and this is really sort of like your bog standard stuff, you know, your staff knowing signs of abuse, what to look for, changes in behaviour, FGM, all of that. So again, you know, please, when you get these slides, go through these bullet points, make sure that you've got, you know, these paragraphs, make sure that you've got all of these things in place. Next slide, please, Hayden. And for the RIs, like I said, we've got 8. Again, RIs tends to be more sort of practice and provision, but again, we do, you know, they do pick up on safeguarding as well, clearly. So again, I looked at these. Interestingly enough, paediatric first aid, you know, came up as that. So, you know, please, again, look at these, just make sure that, you know, you've got all your points covered, but these ones especially 3.6. But it's not all doom and gloom. We have got some outstanding, we've had some fantastic outstanding inspection reports. Next slide, please. And I know I've not got time to read them now, but again, you know, safeguarding came through, you know, fast and furious when people got safeguarding. And if you're on the call tonight and you're outstanding, you'll recognise yourself here. You know, and it's that depth of, you know, that leadership and management. We know that Ofsted are raising the bar on the quality of education, but they're also that scrutiny on leadership and management. And in the outstanding inspection results, that strong leadership and management really, really does come through, as well as that evaluation, constant evaluation of practice. So the next slides just have all of those that I've pulled out. So we can just flip through those, Hayden, if you don't mind, because people can read those at leisure, but I just thought it's worth celebrating because goodness me, you know, absolutely fantastic. So as I said, the other presentations tonight do refer to the statutory framework. I mean, Karen's the SUDI is, you know, the 3.60, but also that what goes on in that child's home life, which is sort of 3.4, and then all the things that Ruth and Dora are going to talk about, you know, that's 3.1, 3.2, 3.45, anything, you know, that health and well-being of a child. So, you know, please, you know, enjoy their presentations as well. And I'll just pass over to Hayden just for the partnership website. So thank you.
Okay, so just to make you aware of where things are, because obviously some of the feedback was that the website was accessible and some people felt it wasn't. I just really wanted to go over where everything is stored so that you can actually see it quite easily. So basically anything for anybody who's working with children and young people that is in relation to procedures, policies, training, forms, anything like that, everything all comes under the professionals tab. And anything under there, as you can see, there's a long list of various different things, but all you need to do when you go onto safeguardingchildren.co.uk is move your mouse over that area, and then this menu will appear. So if you want to see, you know, access 1-minute guides on, as has been mentioned, things like FGM, safer recruitment, you know, anything at all that we have a 1-minute guide on, or you want to see the multi-agency procedures, so because you maybe you're thinking of making a referral, you want to know what to do, or you want to look at some practice guidance in relation to, for example, as we're going to hear about safe sleep and that sort of thing. All of that is available from the procedures, practice guidance and 1-minute guide area of the website. If you're going to make a referral and you phone up 780 you'll be requested to make a written referral within 24 hours of doing that, and you would go to the Forms for Professionals and Tools element of the website to download the referral form. And there are other forms on there as well, so maybe you go and visit a person in the home, and there's the heat assessment tool which you can access, and all of these different tools that are available to you. Or if you're involved in a child protection conference, there's the IRO report form tool that's on there as well. So there's lots of things that you can access from there. Also on this list, as Helen's already said about training, there's lots of training on our website, some of which we deliver ourselves. Anything that's delivered by the partnership tends to be free of charge, but anything that's delivered by the local authority may or may not have a charge depending upon what it is. And then there's also access to an awful lot of e-learning courses, most of which are free as well, and all of that is accessible through there. Some of those links might take you through to NYES to book the page or to book the training and that sort of thing, but we're just using it as a directory to point you in the right direction to be able to book your training. One thing we do recommend that people do is to subscribe to our e-bulletin. If you're not already subscribed to the e-bulletin, then you can access all of the previous e-bulletins that we've issued in the last couple of years from this page on the website. And also there is a link on there so that you can subscribe to the e-bulletin in the future. We also provide information for parents and carers, and all of that comes under, surprisingly enough, the parents and carers element of our website. But as you would with the professionals area, you just move your mouse over it when you go to safeguardingchildren.co.uk. The little menu will appear after a second or two. Don't click on it because it just takes you through to a page with some more information. Just move your mouse over it, this menu will appear, and then you've got the information for parents and carers, and there's all sorts of information there, such as advice and guidance on how parents can choose clubs for the children to go to, about information and advice about leaving a child at home, about sudden unexpected deaths in infancy and safe asleep, and lots of other really useful information, as well as also information about online gaming and setting up appropriate procedures for computers and stuff like that. And some of that might even be useful for yourselves if you're using iPads as a way of stimulating, so that young children don't accidentally press the wrong button and go into somewhere that maybe they shouldn't do, or maybe end up filling out with controls that you don't want them to on the iPad. All of those, there's guides that link to our website that have security control procedures for you to be able to set those up as well. And we also have a resource centre, so there are lots of resources in there. Things like the audit tool is available through the resource centre. But here is the really most crucial bit of it. If you can't find what you're looking for, just search for it. Just type in early years and you'll get everything to do with early years come up in a hit list. It might be what you're looking for might be a little way down the hit list, but it will be there. And on the home page, when you go to safeguardingchildren.co.uk, there's that search box, and that's what that's there for. Just type in what you're looking for. So if you're looking for the self-assessment audit tool, just do early years audit and that will bring that up very easily. I'll now hand you over to Karen, who's going to talk to you about the Day or Night Sleep Right campaign.
Hello, and it's a huge relief to me that you hopefully can hear me and possibly even see me, because I did have a little bit of panic earlier on because I actually couldn't hear anything coming through my computer, and I thought that's just what we need on this dreary, horrible Thursday evening. Thank you very much indeed for inviting me, Helen, to come along to talk about the Day or Night Sleep Right campaign. I've led this campaign along with a number of other colleagues across North Yorkshire and City of York. And the aim is really to try to reduce the incidence of sudden unexpected deaths in infancy, with a particular focus on families with increased vulnerability. I'll talk through the background to the campaign very shortly. But first of all, I just want to say this is, it's a highly sensitive area that we're going to be discussing. I absolutely understand if anybody has had any professional or personal experience, this might be quite difficult for you. I'll just ask Hayden, if you could add my email address into the chat. So if anybody wanted to have a chat after this session, maybe email me tomorrow, and I would be more than happy to pick up a conversation with you. So just accepting that this is obviously a really sensitive subject. Okay, so next slide. What is a sudden unexpected death in infancy? Well, this is the official definition that we work with, but effectively it's the unexpected death of an infant when it wasn't anticipated. So the collapse of the infant wasn't anticipated in the 24 hours prior to the infant's death. And we're referring to SUDIs, I'll refer to it as SUDIs, as infants under the age of 1 year, although there are occasions, sadly, when we do have infants slightly older than a year, but primarily it tends to be in those infants under the age of 1. We sometimes use the term sudden infant death syndrome. It's sort of a little bit interchangeable with the term SUDI, but the official term that we use through our child death processes is SUDI. The one term that we try to avoid using these days is the term cot death, although it's commonly used, I guess, in the general public. But the reason why we try to avoid using that term is it appears to imply that these deaths occur when infants are in their cots. But as you'll see as we go through this presentation, is actually a safe, uncluttered cot environment is very often the safest place for an infant to sleep. So professionals tend not to use that phrase cot death anymore. Okay, next slide, please. It goes without saying, doesn't it, that a SUDI in any family is an absolute tragedy. Sadly, my background is in health visiting, and sadly, I have worked with a number of families where there has been a sudden unexpected death in infancy. And there are certain families that sort of stand out to me in my now 40 years today, actually, I've been a nurse in my career. Those families where there have been SUDIs are the ones that stand out to me probably the most. I still remember the faces of the families when I did the bereavement visits, and the siblings and the extended family and the communities are all impacted by these tragedies. So just to ground us, I'm just going to play an extract, or Hayden is going to, with his magic, going to play an extract from a video clipping from a real family who experienced a SUDI. It's just an extract. You can listen to the full video clipping.
I'm here to tell you about my son Ellis, who died when he was just 4 days old. I'd had a normal pregnancy, I had a fairly normal birth. We decided to take our baby home on the Friday. We were first time parents. We just looked and said to each other, we need him. In the night, he woke up, wanted to eat, and so I took him from within and started feeding him. I was so tired. My neck all of them, and I just maybe a few days ago. I was absolutely shattered, and I fell asleep whilst I was feeding him. I woke up, and my first instinct was to touch his head. Of it was freezing cold, and when I knew there was something wrong, I called for my husband, and he called for the ambulance, and I started on mouth-to-mouth resuscitation. We got to the hospital, and we went to the family room, where it was going to get bad. The doctor came to the family room. It was really over his face. He didn't say anything. I said to him, he's dead, and he just nodded.
I think we'll stop that there. The quality for me wasn't great there, but hopefully you did get some of that. As I say, that video is an extract from a video that's available on the Lullaby Trust website. And although quite harrowing, it does just firmly remind us of the tragedy and very often unnecessary deaths as a result of SUDI. So what we're talking about in terms of the incidence of SUDI, Hayden's going to pop a graph up now that just describes what we've seen over the last few decades. As you can see from this graph, takes us from 1985 up until 2018. And you can see that in the 1980s, 1990s, we had a very welcome, significant drop in the incidence of SUDIs. Now, this was thought to be as a result of very successful public health campaigns. And those of you who are longer in the tooth like I am will remember these campaigns. It was the very beginning of my career as a health visitor, so I remember it very well. And that public health campaign was largely focused on three key messages. The first one being sleeping babies on their back, which remains an absolute firm message. So I think at the time it was called the Back to Sleep campaign. The second clear message that was given was around not allowing babies to get too hot. So actually avoiding swaddling babies too tightly and maintaining a relatively cool environment for infants to sleep in. And the third public health message at the time was around avoiding passive smoking. So pretty successful public health campaign, but sadly we have not stopped all sudden infant deaths taking place. We still have around 300 infant deaths each year as a result of SUDI across England and Wales. So, you know, when you think about that in real terms, we're talking about almost one infant every day. There has continued to be a very significant amount of research into the reasons why SUDIs take place. And those public health messages have continued to be delivered on a universal level primarily by our health visitor colleagues and by our midwifery colleagues during the antenatal and immediate postnatal period. So the research has been going on and the messages have continued to be delivered, but we're still seeing these numbers of SUDIs. So the next slide gives us a little bit of a clue really as to why some of these 300 SUDIs are taking place. There is a national panel, a National Safeguarding Children Practice Review panel that sort of came into being in about 2017-18. And they have responsibility for supporting local areas to undertake reviews in situations where children have either been very significantly harmed or they have died as a result of abuse and neglect. And during the period of 2018-19, they received 40 notifications of infant deaths where the infants had died as a result of sudden unexpected death in infancy, but where there were concerns from a safeguarding perspective. So as you can see from this Venn diagram, during that period of time, there were 325 SUDIs. There were 568 notifications to this panel of all forms of significant injury and abuse and deaths, but 40 of those were specifically SUDI cases. And this was a really very important report for us working in the safeguarding arena, because what the panel clearly acknowledged was that the risk factors for SUDI are well recognised, that there's lots of information out there for families, and that those messages have been consistently delivered. But for whatever reason, the families with the most vulnerabilities, so the families with increased vulnerabilities, and the wording they used was are either unwilling or unable to receive and act on those messages. so that the families with the most vulnerability are the ones who are not following the advice or the information that's given to them on that universal level. Critically, what the panel said was that these deaths are occurring far more frequently in vulnerable families, with many of the risk factors associated with SUDI overlapping with the risk factors for child abuse and neglect. So it was a really important report for us to understand within the safeguarding arena. Next slide, please. What the panel said or advised is, yes, we do need at one end of the spectrum, when we've got universal families where there are no increased vulnerability, so all families, we need to keep giving those messages because they are working in the majority of families. But as we go up the safeguarding spectrum and we're seeing increased vulnerabilities within families, we need to think about enhancing those messages, about tailoring those messages for those families and providing additional support to those families in order to try and support them to adopt safe sleep practices. So that was the message from the national panel. So locally, so the next slide, and pretty much around the same time, we have a process in place. Well, there's a process in place nationally, but we have our local process called the Child Death Overview Panel. And they're responsible for reviewing all child deaths, whether they be expected or unexpected deaths. And what our North Yorkshire and York CDOP found is they did an audit of SUDIs because we were seeing what we perceived to be an increased incidence. And what they found was pretty much the same as what the national panel found, in that these sad, tragic deaths of infants are taking place in families where there are modifiable factors. I'm going to come on to those modifiable factors very soon. At about the same time too, the local safeguarding children partnerships instigated 3 reviews, so extensive reviews into 3 separate child deaths. And what they found again mirrored the findings of the national panel, that these deaths were taking place in families where there were increased vulnerabilities, particularly issues such as domestic abuse, substance misuse, and unsafe sleep practices. So that was the local picture. So we had 2 things telling us we needed to change the way or develop the way that we work with families around sudden unexpected death. Next slide, please, Aidan. So what we did really fairly swiftly is we did an audit to make sure, right, the messages we are giving to families, are they the right messages? Are they research-based, etc.? And we were assured that that was the case. So all families are getting this information. And the vast majority of information that families get is based on the Lullaby Trust. And there will be a slide coming up towards the end advising you how to access the Lullaby Trust. So we were assured that these messages are being delivered. But what we wanted to do is we wanted support from the partnerships executives to adopt a prevent and protect model, which is one of the reasons why you're here with us tonight, or why I'm here with you tonight, should I say, delivering this presentation. Because what we want to do is change that approach so that we give those enhanced messages to the most vulnerable families. So we've done a lot of work really over the last year as a group. And we are coming out to groups like yourself. We have done extensive work with social workers, with early help professionals, with health visitors, with GPs. We're now working our way through housing folks as well to support them to reinforce the messages. We've worked with domestic abuse services and substance misuse services. So you're just part of a big jigsaw, and as I said at the beginning, I'm very pleased to be here tonight to be talking to you about the issue of SUDI. Next slide. Great, thanks, Hayden. These are 2 statements that come from Professor Fleming, who is the eminent sort of person in this field. And we are realistic, and I think we need to be realistic, particularly when we look at that bottom statement. The reality is the vast majority of parents at some point, may not be on a regular basis, may fall asleep whilst they're feeding their infant. I think many of us on this call tonight will recall that sheer feeling of exhaustion when you've had a baby, and although you don't intend to fall asleep with your infant, sometimes that just happens, and as you heard from the video earlier on, that certainly happened for that poor family. What we are trying to do is support families to, if they are going to, or co-sleeping is going to be happening, then that needs to be done in the safest possible way. Okay, next slide, please. So the question I've got for yourselves is, obviously it's not your role to provide that direct education to families for the vast majority of you, but if you were to be providing or supporting families around safe sleep, the question for me is, what information would you access? How would you provide that information? Where, you know, what do you base that information on? If you can pop anything into the chat, that's great. But in the interests of time, I would say that we're going to be showing you the Lullaby Trust website, and the information, all of that information is also accessible, as Hayden has said, on the Safeguarding Partnership website as well. So if you are going to be providing any guidance to families or supporting the messages that are already being delivered on a universal level, then please use the information on the Lullaby Trust website. So moving on now, the nitty-gritty, what are the things that increase the risks? What do we need to be concerned about? So next slide, Hayden, please. I want to now go through the parental factors that increase the risk of SUDI, which infants are most at risk, and the environment issues. How can we make a safer environment for our vulnerable infants? So first one is the parental risk factors. So if you move on, Hayden, that's great. And just pop them all up, that's great. Okay, so these are the key things. There's more detail on the website if you want to access it, and a little bit more information in terms of the research behind this. I think most of us are aware of the issues of passive smoking in households, and that can not only cause respiratory problems for infants and children, but also can increase the risks of SUDI. But really importantly, smoking during pregnancy, we know can increase the risks of SUDI. So it's not just when the baby's born. In fact, there's one key bit of research that points towards 30% of infant deaths could be prevented if we supported and if mums made the decision not to smoke during pregnancy. So really big one there. Mothers' moderate or heavy use of alcohol, again, during pregnancy and also after the birth of the child. So again, it's not just when the babies have been born, it's during the antenatal period. Excessive tiredness, which is fairly ironic given that that's the time when you're most tired when you've got an infant. But excessive tiredness and co-sleeping are the key issues. We also can't forget the impact of prescribed medications. Some medications that might be prescribed, particularly for mental health issues, can make a parent more drowsy or less attuned to their infant's needs. So we know that that can increase the risks. And on a similar vein, really, parental mental health issues. Sadly, we see an increased incidence of SUDIs in families where parents have got mental health problems. And again, sometimes that is about the parents not being as attuned to the baby's needs, not recognising, for example, when the infant is unwell, and not making the safest decisions in terms of sleep. And certainly in the 3 cases that I referred to earlier, which were part of big reviews in North Yorkshire, 2 of those cases there were significant mental health issues for parents, and in 1 case for both parents. So it's certainly a risk factor that we're seeing coming through. Next one, Hayden, please. So which infants are most vulnerable? So which are the infants we need to be particularly aware of? As we've said, infants under the age of 1, although safe sleep practice should be advocated for all age groups, obviously, and the younger, the more important it is. For some reason, and the research has never really been able to identify why, but there's a small increased risks for male infants. And there is also a very significant increased risk for premature infants, and low birth weight infants. Sometimes they come hand in hand, but sometimes they are separate. So really important for those families with premature or low birth weight babies to have increased vigilance around safe sleep. We know that breastfed babies, there is some marginal protection really for those babies, and that's thought to be associated with the waking patterns of breastfed infants, and the fact that they often will wake more during the night. We seem to be seeing less incidents both nationally and locally with breastfed infants. Really important is unsafe sleep position, which I guess could come into the next section, but we'll talk about it now. Sleeping a baby on their tummy or on their side is known to very significantly increase the risks of SUDI. So the back to sleep message is a critical message, and placing babies feet to foot, I think the term is, in terms of their sleep space. So when positioning them in a cot, for example, or a Moses basket or a sleep space, is putting them so their feet are touching the bottom of that sleep space, which makes it less likely they will be wriggle underneath the covers. And infants who are unwell, we do see an increased incidence of SUDIs when infants are unwell, particularly if they've got an increase in body temperature. I put the link on there, and I'm quite happy for this presentation to go out. We just need to remove the trainer notes, Hayden and Helen, if this is going out. But the Baby Check app on the Lullaby Trust website is really very, very good for yourselves as parents. But also if you have a parent who's worried about their infant is unwell, it gives some really good direction on when to seek medical help. Okay, next slide, please. And environmental factors, really big one, this one. Particularly important for obviously those settings as Helen has referenced in terms of 3.60, the sleep spaces and where you position infants to sleep. Cluttered sleep environments significantly increase the risks of SUDI. So those well-meaning multiple teddies and cuddly toys, etc., in an infant sleep space are not a good idea. So we encourage parents not to have a cluttered sleep space for their infants. We discourage use of duvets, cot bumpers and pillows, and this latest sort of fad of these things that swaddle a baby's head. I forget the term for it, but I think some influencers have been encouraging parents to get these things that swaddle the baby's head. And certainly we would discourage the use of them because that we do know can increase the risk. Co-sleeping with other young children and family pets. Now, we specifically put this in because in our 3 cases in North Yorkshire, that was an issue where other infants were in the bed with, other children were in the bed with the infant. That was associated with some other factors, such as domestic abuse, so that in one instance, the mother was trying to protect the children from a domestic abuse incident, so she took all the children into bed with her, and sadly, it was thought that actually increased and resulted in the infant's death. And family pets, it's surprising how many people will put a dog in a bed with an infant, a new baby or an infant under the age of 1 year. Bed sharing with risks present, as we've said, some of those risks. So passive smoking, substance misuse, alcohol misuse, prescribed medication that makes a parent drowsy, and bed sharing are not a good idea. They increase the risk. We really encourage discourage the use of car seats for extended periods of time, and discourage the use of pushchairs for very young infants too. The key reason for that is because when in car seats and in pushchairs for very young infants, when they don't have a great deal of head control, can result in the infants' heads lolling forward and some restriction to the windpipe, so restriction to their breathing. So we really discourage the use of car seats. Too high room temperature is a factor. Chaotic, neglectful households. And I really do want to put a big shout out for avoiding sleeping on sofas and other surfaces such as, chairs, etc. with families, because we absolutely know that comes through in our national data over and over again. And overcrowding often results in families making unsafe decisions for sleep. Yeah, Georgina's put in there, what about a lay flat pushchair? Yeah, I think a lay flat pushchair is fine, but not for extended periods of time, because they tend to be a much closer environment around the infant's head, so there's not as much breathing space for them. So we certainly wouldn't want to encourage it as a regular thing, and certainly not for extended periods of time. And yet, good to hear you've said, Georgina, yours all sleep on mats, but just out of curiosity, yeah, that's a good choice, Georgina. Very good choice, sleeping on mats, because they can certainly be free then, can't they, to move the heads around without causing any problems with breathing. Okay, next slide, please. I just wanted to mention this in particular is the issue of situational risks, which is a term that was used by the National Panel when they undertook their review. You move on and we'll talk about what that means. What the National Panel found, next slide please, Hayden. What the National Panel found was there was a spike in incidence of SUDIs when there'd been a sudden situational risk out of routine, which was in fact the title of their thematic report, Out of Routine. When there was a change of routine, and that meant that the families were unable to, or found it much more difficult to adopt safe sleep practice, these are the types of things that has happened. Changes in the usual sleeping arrangements, so going to stay with relatives where there isn't the most ideal sleep space for the child. As I've mentioned, fleeing or avoiding domestic abuse situations. That has, as I've said, that was the case in a number of our reviews across North Yorkshire and York. And sadly, we see an increased incidence where there's use of alcohol and drug misuse, and that tends to spike at around the celebratory times. Sometimes we see a spike during the summer months when people are having barbecues and maybe drink a little bit more than they would normally and make unsafe decisions, and around Christmas time. So we'll certainly be pushing some messages out over the Christmas period, as we did last year, around unsafe sleep practice. Temporary accommodation, and we have actually just done some work, or a couple of months done some work with our domestic abuse services around refuges and developing a really good safe sleep practice in those temporary accommodation settings. And as I've said, staying with friends and relatives. So there's a spike when we actually come into a situation where we're not in the usual sleep space for the infant, and maybe unsafe sleep decisions have been made. So really important for me to mention that one. Okay, so moving on now, what else is out there for you? So we developed this multi-agency practice guidance. So as we've referenced, families get the information which is based on the Lullaby Trust information, which is fantastic, research-based, absolutely brilliant information. But what there wasn't necessarily is that enhanced information for professionals on how to support families more effectively, particularly those families with increased vulnerability. So as a group, we developed this multi-agency risk minimisation guidance. It is available on the website. So if you go into the professionals icon, as Hayden has said, and if you go into practice guidance, all of that information is there for you. It gives you some really useful research information, why these increased risk factors are there, why we believe certain situations result in unsafe sleep practice. So I would ask you to, when you get 5 minutes, and none of us have many 5 minutes these days, but when you do get 5 minutes, please have a look at that, because that'll support, hopefully, the messages we've shared tonight. Next page, please. Okay. So, what do we want you to do from today? Access the resources, as I've said, and just increase your knowledge. You will have already had, I'm pretty sure, a good baseline knowledge, but it's good to get those reminders. Ensure the safe sleep guidance is followed in your settings. As we've said a couple of times now, that information is there for you. There's guidance there on the early years statutory framework 3.60. and some direction to NHS website, as well as the information for the Lullaby Trust. If appropriate for your setting, have a safe sleep information available. You can order information from the Lullaby Trust website, which I understand is still free. So if it's suitable for your setting, have it hanging around. You know, get some of the posters just to reinforce those messages with families. Encourage the parents to revisit the information that they've had from the health visitor and the midwife. And if you were aware there's particular risks around SUDI, bearing in mind what we've just talked through, seek some safeguarding advice. That should say, does this family need additional support? So, you know, question, does this family need additional support? Do I need to be seeking some safeguarding advice? Because I'm absolutely sure that we've got some concerns around unsafe sleep practice. And ensure safe sleep for infants is part of any multi-agency plans. So for those settings where you may be invited to go to case conferences, or child in need meetings, or even early help meetings and discussions with families, we are really encouraging when there is an infant under the age of 1 year, that safe sleep becomes part of any multi-agency plan. So we're going to be auditing that over the next year to see if that indeed is happening. But clearly that would be really important if there's an infant in the house that's under the age of 1. Okay, the next slide, please. So this is just the national resources. So as well as Lullaby Trust, there's a very good website which we would also suggest is useful, called BASIS. So that information is there for you too. I think there's an app from the BASIS website. There's apps from the Lullaby Trust website too. So lots of information out there for you to support this evening's discussions. Next slide, please. And as we've already said, I don't think we could have said it anymore, is the resources are there for you on the Safeguarded Partnership website. Okay, I think that might be it, Hayden, if you just want to. So I think I've got a few minutes. So there's some references there for you guys if you've got a burning desire to go read the research. I'm very happy to take any questions in the chat if anybody wants to pop anything in. I can see a few hands up, but I think that might have been about the sound issues earlier on. Okay.
Yeah, we
Can't
have got time. We have got time, Karen, because
have we?
yeah, you're a
Yes.
little bit ahead of your schedule. So
Okay.
you know, so
Okay.
we've time, but also we did factor sort of a quick 5-minute sort of toilet break in here if anybody needs a quick cup of tea or anything like that. So but obviously now is the opportunity for anybody, if you want to put questions in the chat or anything, grab Karen while you can.
Hopefully that's
Louise.
because the information's been clear. I'm hoping.
I mean, I would say, I mean, I know I've put it in the chat bar as well, but I mean, from a provider's point of view, Ofsted are checking, you know, where it says check, you know, sleeping babies are checked. They are checking as part of their Ofsted, because obviously it came in as part of the not so new anymore, but the revised framework in 2021. So it is something that I know that they are checking.
Yeah. Liz's put a question in there, is how often would you advise checking on sleeping infants? I think 15 minutes is a really good interval to be checking. Absolutely, Lizzie. I think that's totally appropriate. Yeah. Yeah, so okay, so somebody said they're told 10 minutes by first aid, which is fine. Okay, so I think people have taken some points away with them.
So we've got another one, Karen. If we have under ones, oh, hang on, they're going a bit too quick. Hang on a minute.
Yeah.
If we have under ones, if a child is placed down foot to end and on back, we have two that squirm and roll around. Should I move them and put them back on their backs or leave them?
It's preferred if they're sleeping on their back, but I can absolutely understand why you wouldn't want to be flipping them over on a frequent basis and waking them up. Generally speaking, if an infant, and that usually tends to be about 6 to 7 months, doesn't it? If they are turning onto their tummies, which very often that's what they will try to do, won't they? Then the risks are slightly lower during that sort of later period of 6, 7, 8 months. But if you can, without disturbing them, turn them back onto the back, it is much preferred. The key thing is that there's nothing in that sleep space that they could get their heads, I can't think of a better term, they're nuzzled into. I'm sure you understand what I'm saying. So if there's any like pillows or blankets or anything like that, that's what we would want to be avoiding if you've got little wrigglers. Because, you know, we don't expect parents during the night to be getting up every 15 minutes and checking and turning their babies back onto their back. Does that make sense for people? Okay, yeah, somebody's put there, are they better in grow bags? Absolutely. Yeah, the grow bags are a fantastic idea because generally speaking, they've got the like little dungaree things, aren't they, if I remember rightly, from my health visiting and mother days. Yeah, they actually prevent them from getting under the covers. So I think Lullaby Trust do actually recommend those. I'm just looking at, you mentioned swaddling. I was in a nursery store looking for a crib bed at the weekend. I was told they recommend sleep bags and swaddle blankets. Yeah, I think the grow bags is the same as the sleep bags, isn't it? The thing that we don't recommend is the swaddling really tightly. I don't know whether folks can see me, but I'm sure you know what I mean, is that swaddling really tightly in a very tight blanket will make the baby's temperature grow an awful lot higher. Putting a baby's arms across their chest and wrapping them in is fine, but really tightly is not advised. Do you have a write it down? Right? No, I don't know whether you do need to write it down as a childminder when you're checking them. It wouldn't make sense to me to be doing that as long as you can evidence that that is what you do. But I don't know if there's anything that's come out from Ofsted there, Helen, around actually writing down.
No, there's nothing to write down, but what I would suggest is it's good practice to actually, especially if you're a lone childminder, because it's something that we always say is that actually, if you've not got the written evidence, if it was an investigation for any reason, they would say, well, you've no evidence, therefore it didn't happen, kind of thing. So if you're saying, oh yeah, I check them every sort of 15 minutes, but you've not recorded it, well, then you've got the evidence to show that you're actually recording it, that you're actually checking on them. So yeah, there's nothing written down in the statutory framework. However, if it's feasible and it's doable, and I would say it would be good practice just to do just to have a quick, just have a quick sheet, like you do when you're changing nappies, what time you change nappies. Therefore, what time did you check the babies? Absolutely. Definitely good practice. And I know in nurseries, I mean, I know we've got nurseries on here, but in nurseries, they're often sort of recorded as well. Yeah. So, yeah.
That's really good, Claire. Claire's popped something in the chat. Thanks, Claire. Claire Summerson. You popped in there that Ofsted Regulation 5.1 says all sleeping children must be checked at 10-minute intervals, which is, that's really good. That's really good. I wasn't aware of that, so that's really helpful. Okay, no, anything else?
It doesn't say that in the statutory framework. It says providers must ensure there's 3.51, Claire.
5.1.
3.51.
Yeah.
No, that's 3.51 is providers must ensure there's a first aid kit box accessible at all times with appropriate content.
Yeah, it's just 5.1. Poor Claire won't be able to speak up, I don't think, because I think the attendees are muted.
Sorry, there isn't a 5.1. Claire, can you pop it in the chat and then I can...
Yeah, can have a
Ofsted regulations. Sorry, I thought you said statutory framework.
Yeah.
Right.
That's really useful. Thanks, Claire. Yeah. That is really helpful. Right. If a child is being referred to early help, should the safe sleep still be added to their plan if they have a sibling under the age of 1? Yeah, I think that we are pushing for that, because it depends on the reasons why they've been referred to early help. Generally speaking, if a family is certainly in the child protection arena, it's generally because of some of the issues that we know to increase the risks of SUDI. Does that make sense? So generally speaking, it is a good idea to have safe sleep, but it will depend on the reasons why early help are involved, or why there's an early help plan. But it should always be a consideration, is what I would say. Because what the national panel clearly is saying is we need to be thinking about SUDI prevention through a safeguarding lens, and early help is one end of the safeguarding spectrum. So certainly consideration. Okay, that's great. That's really helpful. Okay, guys, that's I think that might be all of the questions. Thank you so much. My email address has been put into the chat. So as I say, it is a difficult subject to talk about, not the easiest thing to discuss, but I know that you, and certainly looking by the responses, everybody absolutely appreciates why it's completely essential that we're all as clued up on this particular issue as possible. Okay, well, I will love you and leave you and say thank you very much indeed for this evening. And I hope the rest of the evening goes well. Thank you.
Karen, thank you so much for joining us this evening. We really do appreciate it. And
that's great.
Yeah, and I say you've got Karen's email address, or if you've got difficulties, just email me and I'll get in touch with Karen or Elaine, who also works with Karen. So yeah, thank you so much.
No problem.
And lovely. And now we've got Ruth and Dora, and you've got a little bit more time, Ruth. So, so I mean, I haven't seen Susan yet, but yeah. So you've got a little. Karen's very genuinely given you sort of another 10 minutes back. So lovely. Thank you ever so much.
Okay, brilliant. Good evening, everybody. Myself and Dora, I don't know if Dora's going on camera or not, are here tonight. I don't know if she's appearing. Just to do a bit of a double act about health prevention. just to say that I'll do the presentation and Dora will be doing questions. So if you want to put any questions along the way in the chat, please feel free to do so and we can take it from there. That's Dora saying she can't turn her camera on, so I don't know if you want to let her in, Hayden. So we're going to talk today about prevention, infection prevention and control and immunisations, because that's quite important at the moment in your settings. So we'll cover IPC general principles, the public health management of common infectious diseases, the importance of immunisations and what you can do in your settings to encourage them, how you deal with outbreaks, and reporting and contact details, because some of those have changed for you. Next slide, please. Thank you. So for a background context, we've been seeing quite significant numbers of circulating diseases in schools and early years settings at the back end of last year and in this autumn term. So whilst last year we were all concentrating on COVID constantly, we've sort of forgotten that there's quite a lot of other things going on. So primarily at the moment, we're seeing quite a lot of scarlet fever and chickenpox. Now, one of the things that we wanted to mention today is most people don't know that if you have chickenpox and scarlet fever circulating at the same time, it can create complications if children get both, or adults for that matter. So you just need to be aware of that. The flu and COVID vaccination programmes are currently underway, and it's important that we increase uptake in both, and we'd like your help with that if we can. Lots of infectious diseases in schools and your settings invariably are leading to children and staff absences. Now, you have all had tons of that in the last 2 years, so really want to do everything we can to reduce those absences this year and get things back to normal. Good infection and prevention control measures can also help reduce your infections, which is protecting the staff and the children, which links very clearly to what you've all been talking about tonight and why you're here, is your Ofsted framework, which clearly states providers must promote the good health of children attending the setting. They must have a procedure for responding to children who are ill or infectious and take necessary steps to prevent the spread of infection and take appropriate action if children are ill. Now, that's in your framework, but also as employers, you also have a duty of care to your staff. So anything you do to prevent infections is also preventing your staff becoming ill, and you need to bear that in mind. Next slide, please. I hope I don't look like Chris Whitty, just thought I'd say that. So general principles of IPC, and you'll be pleased to know there is no mystique here. It is common sense. So I know everyone gets very worried about this, and clearly after the 2 years we've all had, it's quite understandable, but actually you can all deal with this, and you can all deal with this quite simply. Good old hand hygiene is still the best way forward. It will control all those infections, especially the diarrhea and vomiting bugs that you get quite a lot of, and the respiratory infections. So just continue with the things that you've already been doing through all of the COVID and pre-COVID. Encouraging children to wash their hands and staff to wash their hands. But the big thing here to remember is that it's soap and water are the most effective. We've all been lulled into a little bit of sense of, alcohol hand gel will solve everything. It's effective up to a point, but it will not kill everything. So it's not going to take away the organisms that are causing gastroenteritis and things such as norovirus, and they're nasty and you don't want them in your setting. So please make sure you're mixing what you're using. So particularly when children and staff are going to eat or from the toilets, warm water and soap are the best way forwards. Now, I know in your settings, a lot of your children are going to be very young. So it's really about creating routines that they will take into older life. Once they've got to 3, then you might be able to do some more constructive work with them. And there's a resource called eBook, which the link's on the sides for, has some really good resources for teachers and early years, which with lesson plans and all sorts of things that you can do with children to encourage them to understand why hygiene is important. But really, for a lot of your younger children, it's really about role modelling from your staff and encouraging them, setting a routine that they're doing it all the time. Next slide, please. So general principles again for infection prevention. Respiratory and cough hygiene, again, it's the same old thing. Coughs and sneezes spread diseases. It's the age-old saying, but it's true. So if we can cover our nose and mouth when sneezing and coughing, we reduce infections. It's as simple as that. Now, again, I know you've got very young children, and again, it's about role modelling and staff doing it for them, and staff being key role models about what goes on. And again, for the older children, use the ebook site. It's really good. In smaller settings like yours, where you've got lots of handheld, malleable things, cleaning of equipment is really important. So disinfecting and cleaning your equipment weekly or as often as you can, particularly those areas where there's lots of ball pools and things like that with children in and out all the time. But again, there is no mystique to this. Cleaning with detergent, and that should say hot water, I'm afraid, is normally all that's needed. So good hot soapy water will clean a lot of things away, and it makes such a difference. And again, it's nicer for your setting to be clean and tidy anyway, you know, and people coming around seeing that, it's always setting a good example when you've got new parents coming to look round. That's what you want them to see, a clean and happy setting. Next slide, please. Ventilation, and there's a lot being talked about ventilation now, particularly COVID's really opened up this debate. By letting ventilation into your settings, you are letting the bugs out. It's as simple as that. So air circulation will remove those viral particles, which is reducing the spread of respiratory infections. Now, it's not as difficult as it sounds. You don't have to have the windows open all the time, but if you can think about regularly opening the windows, regularly getting some airflow through. In general, we have settings too hot, and we've just heard, unfortunately, about the infant deaths where children can be too hot. So actually turning the temperature down slightly and having some air ventilation is not going to hurt the children. It's more likely to be the staff that complain about it. Think about the times when it's most easy for you to ventilate the rooms. You know, so if the children are going outside, then leave the door open, let some fresh air get in. I mean, I appreciate you don't have playtimes the way that they will do in schools, but quite often the children are out and playing outside. Use at the end of the day, leave the doors open for a while you're cleaning. Same in the morning if you've got a chance to let some fresh air get through. So it's just thinking about what works for your settings. I'm very aware that you've got a huge wide range of settings within early years. So you've got to think about what works for you. If you do believe you've got an area of poor ventilation and you don't know what to do about it, there's lots of advice about, and there's a link on here. Once you get this, you'll be able to look through that and see if there's anything else that you can do to help improve your ventilation in some of those poorer areas. If you want more information on infection prevention and control, the link to the government document, it's a really good document, really clear and really useful. So I would encourage everyone to have a look at that. Next slide, please. So from a public health team, what do we do about managing infectious diseases? Really, what we're going to do is monitor it. But some of the things you need to be aware of are these. So chickenpox and shingles, that's normally circulates between March and May, although we did see some change in that last year. Shingles is generally the adult version of chickenpox. Once it's a virus that you'll get if you've had chickenpox, and it can be really quite nasty. So as can chickenpox in an adult. So we're talking here about thinking about the children and the staff, because your staff do not want to come down with chickenpox or shingles. Children with chickenpox shouldn't be in the setting until the blisters have crusted over. And going back to what we said right at the beginning, if you do have scarlet fever circulating at the same time, then you do need to report it. And the reporting is now to the UK HSA Health Protection Team, and we've got the numbers for that later on in the slide. Diarrhea and vomiting, again, can go through a setting like wildfire, and it's very infectious. So we really need to be excluding people, again, staff included, who have got diarrhea and vomiting for 48 hours after the symptoms have stopped. Now, I know that's really quite difficult to get through to people, and you can never really check it. But I think some of it is creating an environment in your setting where staff understand why they shouldn't come back and understand the consequences of them coming back too early, and you being supporting them to do so. If you do have reports of that in your setting, again, we go back to the good hygiene practices, particularly good hand washing practices, and cleaning of areas such as toilets, you know, and increased cleaning in that area is always going to help. Next slide, please. So flu and other respiratory infections. We know from Australia that there is a high likelihood that we will have increased flu this year because they've had that and they get it first because they're in the southern hemisphere. So there is a high likelihood there's going to be a lot more flu about this year. It's very infectious, you know, and again, exactly like COVID, it will spread in close places. Anyone with flu or symptoms of flu are advised to remain at home until they are feeling better. Now, again, that's quite difficult to check, but you've just got to keep advising that. But the flu vaccine is now available for anyone over 50. So you will all, well, not all of you, but a lot of you will have staff within that age group. So it's encouraging those people that are eligible for the flu vaccine to go and get it. You can't make anybody, but you can encourage them because it keeps them safe, it keeps your children safe, and it keeps the rest of your staff safe. It may be worth thinking about, depending on your staff group and the costs and whether you can afford it. Sometimes it might be more cost effective to actually offer to pay for flu vaccines for your staff. Now, I'm not saying you've got to do that, but it's something you might want to consider because it will reduce staff absence. Other respiratory infections, including COVID, which, you know, we're all sick of hearing about, but is still there. There are such a range of symptoms now with COVID, you know, the runny nose, the high temperature, the cough, the sore throat, the aching, it can go on forever because we've got so many variants now. But the advice from COVID has not changed now since the government roadmap in April. So children with mild symptoms can continue to attend if you know they've got it. However, children with a high temperature should stay at home, and I think that's where you need to monitor it. In fact, children with a high temperature for any reason shouldn't be in the setting because they're clearly unwell and are clearly going to spread something to other people. So if you do have people who have tested, because some people still are testing, and you know that they've got COVID-19, then the children really should be at home for at least 3 days, and staff should be at home for 5 days. And really, that's the guide. If they're not well, they shouldn't really be back at work or they shouldn't be back in the setting. And you've got to think about how you manage that with your parents and your staff. And remember that if you feel a child is unwell, then you can send them home. They shouldn't be there if they're not well. Next slide, please. Scarlet fever, we are seeing a lot of this at the moment, and it's even this term we've already had quite a lot of notifications of scarlet fever. It's a bacterial illness, which a lot of people don't know, caused by group A streptococcus. Children need antibiotics for scarlet fever, so if you are notified by a parent that their child has got scarlet fever, they should have been given antibiotics by the doctor. What people are not aware of, that actually once they've started their course of antibiotics, they can return to the setting after 24 hours. So it's not that long after starting their antibiotics. If you do have an outbreak of scarlet fever, then you need to inform UKHSA. And again, particularly if you've got chickenpox circulating at the same time. There's more about these infectious diseases in the government document of which there is a link to, and it's really useful that within there as well, there is right at the back there is a table that tells you about all the exclusion for every single disease, which will be really useful for you, but for your information, but also when discussing with parents who have got different illnesses that they might inform you of. Next slide, please. So, moving away from infection and prevention and talking about immunisations, we're having a real push on immunisations at the moment to try and support the immunisations teams because we are seeing a slight decline in immunisations in North Yorkshire. For vaccines to work, we need to achieve high levels of immunity. they are the most successful way to prevent diseases and reduce the spread of infection. If we've got high levels of immunity, we can get what we call herd immunity, which I'm sure most of you have heard of before, whereby because there's such a high level of vaccinated individuals, the small amount of people that are not vaccinated are protected from that bug because it hasn't got enough people to move to. However, it is quite a high level of immunity of vaccinations that we need, and you're looking at 95%, so that's a high level, and we are starting to dip down. One of the problems, I think, is that in fact a lot of people don't understand, have never seen some of the the diseases that we immunise against. So a lot of staff will never have seen anybody with mumps or measles or rubella, and so they're not really aware of what that means. So we really need you to help us support immunisations, because you're talking to parents and you're sharing information with parents, and you can give prompts and reminders to parents about getting their children immunised, and that they should be due their vaccines. Have they got their vaccines? And we'll talk a little bit more about that in a minute. Next slide, please. So children's immunisations in early years settings are laid out there. So at 1 year, they've got several vaccinations that they should get, and most children do get those. That's not where we're seeing such a drop. It's the 3 year, 4 month vaccination that seems to be dipping a bit. When we think some of that may be because people are busy, parents are busy, parents are back at work, their children are with you, and they forget, and they don't get as many reminders as they used to. And that's where you can help. So if you've got children moving up from, I don't know, whether you're going from your toddler room to your next preschool room or whatever you call them, it's reminders at that sort of point saying, oh, by the way, have you checked if your child needs its booster? Have you got your second MMR booked in? Have you heard from the doctors? Little reminders and prompts from you can be really, really useful, because parents are busy and they're not tuned into this. Why would they be? They're not going to know. But you will know, and you see it every day, so that will really help. We've also got now the flu vaccinations for children between 2 and 10 years. So the 2 to 3 year olds are now eligible for a flu vaccine. Going back to what we were talking about before, it's really important for you to encourage that, because children can be quite ill with flu, but they can also pass it on to other children and your staff. So anything you can do to help support the flu vaccination programme will be really useful. And I think we sent out posters and a leaflet last week that you can display, and just prompt again, if you've got newsletters going out to your parents, just prompt it and remind them that their children are eligible for that vaccine. Most of the vaccines for the early years are all done by the GP. So if parents are unsure, signpost them to their GP letters, to their GP, who should be able to pick up what they need. Next slide, please. So staff immunisations. Again, as adults, it's up to them what they do with their vaccinations. But again, you can encourage them and ask them about it, and point out to some of the staff that what might happen if they're not up to date. A lot of you will have quite young staff in some of the bigger nurseries I know who are really not thinking about this, and because it's that stage in life. And so you do actually need to educate them to a degree about what some of these diseases are and how it could affect them. The MMR vaccination, particularly the measles, mumps and rubella, is one that some of them have missed, and it's making sure that they've had the 2 doses of the MMR vaccine. Measles, mumps and rubella are nasty diseases, and their viral infections can spread quickly and cause outbreaks, but they're quite nasty and people don't know how nasty they can be. But particularly for some of your staff, rubella caught in pregnancy can lead to miscarriage or cause very serious harm to an unborn baby. Now, you will have quite a lot of staff in your settings that may be thinking about getting pregnant, or of an age that they may be thinking about getting pregnant. So encouraging them to think about their vaccines and understand why the MMR vaccine might be the one that they should be checking on is really important, given that they're working with young children where these things can spread. There's lots of information about it all over the place, and it's a free vaccine, so anybody who's missed out will not be charged. They just need to contact their GP and get their vaccinations up to date. Okay, next slide, please. Some of the information that we give out about immunisations, we need to think about how we do it, and this has come not necessarily from us. This has come from people who work with behavioural approaches and insights, and lots of research has found that using text and emails as reminders rather than using apps or platforms, which probably not a lot of you would do that, but some of the schools do, is actually more effective. Parents are busy and they tend to pick up texts and emails because they can look at them when they've got the time to look at them. Timing of shared messages has come out as quite important as well, and there's lots of evidence to say that sending reminders in the early evening when the kids are in bed, as opposed to during the day when parents are busy trying to work and do other things, can be a lot more effective. Language barriers are another issue. Now, North Yorkshire doesn't have high populations who are non-English speaking, but we do have lots of people that are spread throughout the county. So you may only have one, maybe two families that where English is an issue. So please be aware of that, and if you know that that's an issue, try and find some help for them. There are lots of resources around vaccines in different languages in the government documents and the links below. So if you go in there, you'll find all sorts of things that you will be able to use. So be aware of what barriers there are for your parents. And linked to that is digital poverty. We have still got quite a lot of people who are not digitally active, can't afford to get online, can't afford the data, or just simply live somewhere that they haven't got a signal. So if you know you've got families that are struggling with that and they can't access the emails or text, you know, can you print something out for them? You might not have to print out for everybody. I appreciate there's a cost there, but you know which families are going to need it, or even just talk to them. You'll again know the families that need the extra help, and that refers back to the previous speakers, what we're talking about. You know your parents, you know which families are struggling and what they might be struggling with. So think about that in your communications and try and target appropriately to the right people. Next, please. So dealing with outbreaks and incidents. We've talked about infection prevention control, and most of the outbreaks can be managed by that. So if you've got something happening, if you've got diarrhea and vomiting, or you've got a chickenpox or scarlet fever outbreak, all those infection prevention control measures become more and more important. So you need to continue that and maybe increase your cleaning. But the key is encouraging unwell people, children, young people and staff not to attend the setting. Because the more people come in when they're unwell, the more children that come in when they are unwell, the more we spread this. So we do need to remain separate. And we go back to our COVID days, and we're not going back to sort of completely separating everybody in bubbles. But the principles that we learned through COVID were that the more people are together and the more people that are ill together, the worse it gets. So it's encouraging and building on that, because parents and young people do understand, staff do understand that from COVID. So we need to use that. We need to build on that, what happened in COVID, and keep reminding people that actually this still happens. There's still all these diseases. We've still got COVID-19. So please think about it. If you're not well or your child isn't well, please don't send them in. We talked earlier about exclusion period. There is a table on there that will give you the link. It's really, really useful. It goes through every disease and tells you when children shouldn't or shouldn't be in an educational setting. Encourage immunisation. That's the best way forward. The more we immunise, the more we move towards herd immunity, and it reduces the infections, and it reduces the seriousness of the infections. Particularly COVID, we are seeing COVID going up again. And we've already said that we're expecting more flu. So even for the staff that maybe think, well, you know, I'm fine. They're all going home. They've all got grandparents. They've all got people somewhere along the way that are maybe not as fine with getting this, that they may be immunocompromised. They might be in a risk group. And it's constantly reminding people that immunisation is not just about that one person. It's how you protect other people. At the end of the day, it's all an education programme. We can't make people take up a vaccine, but we can encourage and inform as much as we can. Encourage occupied spaces are well ventilated, letting the fresh air in. It's really simple things that work, and good hand hygiene practices. Make sure that your parents know that they need to notify you if their child has a diagnosis of an infectious disease, because sometimes they don't think to do so. So, you know, if somebody's gone home, they might just ring in and say, oh, you know, Johnny's ill, he's not coming in. But actually, you need to know why, because if that is scarlet fever or something else, and they've been in the setting the day before, you need to be able to put infection prevention control measures in place and inform other parents if needs be. Next slide, please. So if you do have an outbreak or incident, you need to consider a few things. So we briefly touched before about communications. So if you've got something circulating, you do need to let other parents and carers know. You don't need to necessarily say who it is that's got something, but you do need to make sure that people are aware, as we did with COVID, make sure that they're aware that something is circulating in the setting. And going back to what we said before, think about those people who might need that communication in a different way, whether it's a language or whether it's a printed version or it's actually a verbal conversation. Reinforce the key messages among the children and young people, hand and respiratory hygiene measures, going back to your ebook resources. And if you can, and you do have those, maybe discuss with health visitors or school nurses if you're attached to a school. Now, I know they are not as easy to get through to these days, but if you have a specific issue or you have a safeguarding issue where you have concerns about a child in a family, again, going back to what was said by the previous speaker, please try and get hold of your health visitors because they can be really, really useful. Next slide, please. So last year with COVID, you all got very used to talking to us all the time, and I think we've spoken to quite a lot of you over the last 2 years. It's changed slightly now because we now have the UK Health Security Agency and they have their own health protection team. So your first point of contact will actually be them. So you contact their health protection team for advice if you're concerned or you've seen a higher than previously experienced or rapidly increasing number of staff or student absences due to the same infection. So, for instance, we've had, you know, maybe 1 or 2 schools come back to us about scarlet fever this year. So they'll inform UK HSA, who will help them through, and they will actually even give them things like letters to send to parents. So they're really, really helpful when you informed them. If you've got evidence of a severe disease due to an infection, so for example, if a child or a young person is admitted to hospital, which we do get from time to time, then that needs to be notified. Or if you've got more than one infection circulating, particularly scarlet fever and chickenpox, but again, if you have more than one infection, then that's notifiable as well. You may have an outbreak of a serious or unusual illness, given the list there: E. coli, food poisoning, hepatitis, measles, mumps, rubella, which is also German measles for those people that get mixed up with that, meningococcal meningitis, septicemia, scarlet fever, TB, typhoid, whooping cough. There's a whole range of things there that are quite unusual, but if you do have a notification from a parent of that, then that needs to be notified to UK HSA. Okay, next slide, please. So on this slide, and this is all going out afterwards, and I know Helen said at the beginning that we have some additional material for you as well, with some posters and some letters that you can use to send to parents to encourage immunisations. But these are all the links that are throughout the presentation, and there's some really, really useful documents here. The health protection one from the government is really good, so I would really encourage you to have a look at all of these. Some of them are quite long, but quite a lot are put into quite usable chapters. and there it's really quite clear as well. So have a look at those. I think you'll find them really useful. Next slide, please. And we are nearly done. So your reporting and contact details. So your first point now is UK HSA Health Protection Team, and the numbers are on there. But we haven't gone away. So the public health team in North Yorkshire are all still here. So if you need additional support or you're just not sure, we're not going to turn you away. Please contact us. So you can either use the dph@northyorks.gov.uk email address, or you can use the COVID one if it is COVID-19 specific. To be honest, that is not going to get switched off, and they'll be picked up either way. So if you use the education one by mistake, because that's the first one you find, it's fine. It's still monitored, and even if it's not a COVID query, we'll deal with it. So don't feel that you can't come to us because UK HSA is your first point of call, because it might be that you just want to ask us if we need to, you're not sure whether you should be notifying or not, and that's fine. It will be picked up and we will reply to you. So or any other questions you might have on some of the guidance that's come out, or some of the stuff that we've talked about today that doesn't get answered now, then please drop us a note and we will be able to come back to you and hopefully advise you on your setting. And I think that is it. Is it? Next slide. I think that's the end. Yes, we are. We're done. Well, thank you very much for listening. I don't know what questions we've got in the box. Dora's been monitoring those, so I'll let her come in and answer anything that's there.
Thank you, Ruth, so much for this. I think I've answered most of the questions, and there are a couple. One that I promised I would try to answer just because it's a little bit more complicated. It's not straightforward. And one that just came in. So back to Georgina's question. Again, feel free to put more questions in the chat box and we can answer them now. I know we're sort of running out of time as well. So we will always get back to you, even if it's in the chat box or via email or something. So Georgina did ask, what would we advise with regards to CalPOL? A lot of settings are not accepting children into their setting if they have had CalPOL within 24 hours of their session. This one is a little bit tricky, and the reason it's tricky is because there's no sort of guidance or framework around it. So there isn't anywhere. If you were challenged, if you were to say we're not accepting children within 24 hours, and you were challenged as to why you're deciding that, there isn't sort of a government guidance document that you could point to say this is why I'm doing it. Whereas, for example, if, as we said earlier, you knew that somebody had scarlet fever, then you could say, I'm not admitting you to the setting until you start antibiotics, as Ruth explained earlier. So it's a little bit tricky. I appreciate that you've got a little bit more freedom with regards to who you accept and when and things. So I would be reluctant to sort of say, yes, go with that, because there might be a load of reasons why a child may have had CalPOL in the next in the previous 24 hours, but doesn't necessarily mean that they can't attend. In the pack that Ruth has pulled together and that Helen will share with you shortly, there is a useful, I think, poster for parents that tells them when they can and when they can't send their child to school or nursery. There are things there, for example, tonsillitis, where if a child has tonsillitis, technically they can be in the setting as long as they are well enough to do so. So, you know, all I'm thinking is that child may have had CalPOL in the last 24 hours for tonsillitis, but technically they can't be in the setting. So it is a little bit tricky. Personally, I wouldn't go with that. Personally, I would go with the exclusion table. I have put a link to that, and it is in the slides that Ruth just presented as well. And I would go with sort of a national guidance, just because, and again, COVID taught us that quite a lot, didn't it? That if parents decide to challenge any of your decision making, you've got something to back yourself up with. If anybody says, why would you not admit my child, I suppose. I hope that answers it, Georgina, but do let me know if it doesn't. Just to go to the other question around, if a child is diagnosed by a doctor with scarlet fever, would they not notify UK HSA, or would you? I'd say best practice, scarlet fever is a notifiable disease, so the doctor should, but I think best practice would be that you would do it as well. UK HSA will be sort of getting that information potentially from both of you, but it's better to have information twice than not at all, I think. So I would say if you have the time and ability to do it, I would report it because it is a notifiable disease, even though you might know that the GP will have done it as well. Better safe than sorry, I'd say. In terms of hand, foot and mouth, yeah, I think it's always going around, if I'm honest, but yeah, it's not a notifiable disease, hand, foot and mouth. The table, again, that I shared a little bit further up the chat, does say how you would sort of deal with it, but there's no need to exclude any sort of children or anything like that for that particular disease. Just to say, if in doubt, as Ruth said, we are still here, we can still support. So if in doubt, speak to us or speak to UK HSA. But yeah, just to reiterate, the guidance that we've shared and Ruth has presented on is actually really, really helpful. So it should have most of the answers to questions that you've got. We appreciate having worked, you know, throughout COVID alongside all of you. Things aren't always straightforward and things can get complicated and quite tricky and very quickly. So yeah, if in doubt, just give us a call, and between ourselves and UK HSA, we will make sure that you are supported. I think if one good thing came out of COVID is that I hope you know that you're not alone in all of this. So and we've got quite a lot of capacity to be able to support. So I don't think there are any other questions. Obviously, if you think of anything, you've got our email addresses there, and you know both myself and Ruth. So if there's anything, feel free to email us. But I think we'll stop here if that's okay, Helen.
Yeah, that's absolutely fantastic. Thank you so much. And yeah, I mean, as we're hitting the flu season and everything, it's about keeping children safe, keeping your staff safe, keeping parents safe. So yeah, thank you, Ruth and Dora, very much. And yeah, there are the additional materials that we'll send out when the slides go out. So over to Susan. Thank you very much.
Good evening, everybody. I'm sure you're looking forward to this session ending. So this is the last session of your evening for you. And it's just to cover as briefly as we can in the time we have managing allegations. So if we can just go on to the first slide, please, Hayden. Thank you. So just to cover what's an allegation, it's one of those things that sometimes people get confused about. We don't have to wait for a parent to make a complaint. We don't have to wait for anybody to make a complaint. What we have to do is to establish whether we have any of the four things that are listed here. So first of all, has somebody behaved in a way that's harmed or may have harmed a child? Have they possibly committed a criminal offence against or related to a child, behaved towards a child or children in a way that indicates they may pose a risk of harm, or behaved or may have behaved in a way that indicates they may not be suitable to work with children? So just unpicking those in a little bit more detail. So firstly, have they behaved in a way that's harmed or may have harmed a child? So when we're talking about harm, we're talking about the categories that you would recognise: sexual, physical, emotional and neglect. There's a bit of the first sentence missing for some reason, so we don't have to have a child harmed if we have behaviour that could have harmed that child. So those might be some of our neglect issues, where we have children who leave the setting unsupported, or where there's medication errors, a child gets too much or too little medication. So that's what we're talking about: harmed or may have harmed a child. Criminal offences against children, again, fairly straightforward. A lot of the criminal offences we deal with within our area of work are individuals accessing indecent images of children. So it doesn't need to be a named child or a child that somebody has contact with. Criminal offences relating to children may be online offences. The third criteria there is behaving towards a child indicates they may pose a risk of harm. So that's where harm hasn't happened, but if the behaviour continues, we would have concerns that in the future children may be harmed. And the fourth criteria is behaved, and that's behaving not towards a child, and that would indicate behaviour towards an adult that indicates that somebody may not be suitable in terms of working with children. So that might be serious sexual or physical offences against an adult when somebody works with children. Clearly, if somebody has harmed an adult, we would need to be concerned whether they are suitable to work with children. Similarly, we would consider within this firearms offences, significant drugs offences, knife offences, and also some of the extremist behaviour and the concerns about that area as well. So those are the criteria for an allegation. They are statutory criteria. They come from Working Together to Safeguard Children 2018. And again, the guidance that you'll usually come across will be your own early years and foundations stage framework. And there's lots of additional information in Keeping Children Safe in Education. I know some of you don't need to follow that, but it is a useful document, and it has a whole chapter, a whole section on managing allegations. So the key thing is, if you have concerns that you've seen behaviour or are aware of behaviour with a member of staff in your setting that might meet one of those thresholds, then it needs to be reported initially to the LADO and also to Ofsted. So if we go on to the next slide, we'll just cover what happens next. Just before we do that, I just want to talk about is one of the areas that we actually need to consider as well is a thing called transferable risk. So sometimes we have to consider people's behaviour outside work and or relationship with other people, and whether that will have an impact on our ability to work safely with children. So this might be where, as a parent or carer, their own children have become subject to a child protection plan, child protection procedures, and you will absolutely understand that in those situations a threshold of significant harm has been met in relation to a child going on a child protection plan. And if that's in relation to their own children, what we do need to have a think about is whether that poses any risk to the children they're working with. I've already mentioned transferable risk from possession of weapons, serious drugs offences, etc. on the previous slide. And the fourth thing we have a look at is whether they're associated with somebody in their personal life who may pose a risk of harm for children that the adult's responsible for. So we also will consider somebody's partner. So if somebody's partner has been arrested and or convicted of offences against a child, does your members of staff association with them bring any risks into your setting? And I recognise that all of these are very sensitive areas, very difficult areas. And what we're not asking you to do is to make, definitive decisions. What we're saying is be aware of these, make sure your staff are aware of them. And where you've got anything that you want to question or check out, then contact the LADO, because we'll be able to assist you in determining whether it does meet a threshold, and if it does, what we might need to do next. Thank you, Hayden. So again, a lot of this will come from the statutory framework that you'll be aware of. One of the things it talks about is your policies and procedures need to include explanations of what needs to happen if an allegation is made against a member of staff. You're registered as registered providers, you need to inform Ofsted or childminding agency of any allegations of serious harm or abuse by anybody living, working or looking after children on the premises. Registered providers need to inform Ofsted or the childminding agency of the actions taken, and these notifications must be made as soon as reasonably possible, reasonably practical, but at the least within 14 days of the allegation. And again, being aware as you are that if you don't do this and fail to comply with it, then Ofsted have considerable difficulties in terms of that. So where we have got concerns that arise, where you are aware of things, it's important that you contact Ofsted as soon as possible, but it's also important you contact the LADO, because one of the things that Ofsted will do is check whether the LADO has been involved, what advice they've given. And certainly when we've had situations where Ofsted has not been informed or we've not been informed, then it causes some difficulties of the settings going forward because they failed to comply with the regulations that apply. Next slide, please. So again, what it says here is it's important to notify the LADO. Sometimes we have a notification goes to Ofsted. Sometimes, you put a referral in for a child. Sometimes the setting is set off and done an investigation. But it is important that the LADO is notified. And the LADO procedures, and I'll tell you where they are later, talks about within 24 hours, so as soon as possible. So where there is concerns that somebody has harmed or may have harmed a child, then you need to phone into the duty LADO, and the number is on the last page of the slides, as well as contacting Ofsted. It's also important that you do it as soon as possible before you start any internal inquiries. The reason being If you've investigated and done too much of an investigation, the difficulty may be if there's going to be a police investigation, because if all the statements have been taken and an investigation has been done, it may have implications as to how well the police can conduct any of their investigations. So just important not to rush off and do things, but to take some advice in the early stages as far as we can in terms of that. Thank you, Hayden. So again, it's important that you train staff to understand your policies and procedures, make sure they have up-to-date knowledge of all safeguarding issues. And this also includes having an awareness of when behaviour of colleagues might be of concern. So are staff behaving inappropriately towards children, any inappropriate comments they're making? Are they having excessive one-to-one attention beyond the requirements of their role? Is there any inappropriate sharing of images or other things that might be of concern about individuals' behaviour? And it's important that your staff are confident to report that to you as whoever's running the setting, so that you can be alerted to that and take action as appropriate. So it's important that you have something that looks like a code of conduct, so that staff are aware of what they can and can't do, what they should and shouldn't be doing. It's important that you have good induction training, that staff are aware of what their expectations are, not only of their own behaviour, but their expectations of reporting concerns about colleagues where that's appropriate to do so. Good ongoing training in terms of child protection, in terms of those areas, but also an ability to sit down and talk to staff about how things are going, whether they've got any concerns. So a level of supervision within that as well. Thank you, Hayden. Again, it's important that your staff are aware that they need to advise you if they have any convictions, cautions, court orders, reprimands, warnings that might affect their suitability to work with children, not only before they start with you, so you'll be doing this at your recruitment process, but also when they are employed by you. If anything comes to light that might affect their ability and suitability to work with children, they need to be notifying you of that. And most organisations will put something in the contract of employment that makes it very clear to staff that they must do that and the consequences of them not doing so. Again, it's important through your safe recruitment practice to ensure people have appropriate criminal records checks, and where those aren't in place, to make a decision whether people can start without them, and if they do start without them, how are you going to make sure that they don't have any unsupervised contact with children. And again, if somebody has been dismissed because of a safeguarding issue, again, there is a legal responsibility for you as a setting to make a responsibility to the Disclosure and Barring Service for them to consider whether somebody should be barred from working with children in the future in any other setting with children. Thank you. So again, it says a registered provider must inform Ofsted or the agency with which the childminder is registered of any significant offence that might affect the suitability of people. That could be the disqualification of employee. It could be that somebody, if there's a childminder on domestic premises where somebody else living there would be disqualified if they were working with children. And again, there are some situations, and you'll be aware of these, where you can get a waiver for those disqualification orders. But it's important that your staff make you aware of things that might impact on their ability to work with children, so that you can assess that, you can do risk assessments, and you can determine how that might take things forward. Thank you. So what happens if an allegation is made? I think the first thing to be clear is that an allegation does not mean that somebody is unsuitable to work with children. It means that something might have happened that gives us concern, that may need a disciplinary sanction, may need some additional training, and in the most serious consequences may be that somebody's dismissed. But we aren't starting off with an assumption that somebody will lose their job. We're not starting off with an assumption that somebody should be suspended. What we need to do is to understand what's happened, why it's happened, and make some judgments going forward. So when individuals phone through to us and give us some information about what's happened, we'll almost certainly ask you to complete a referral form, and that's on the Safeguarding Partnership website. That gives us as much information as we need in terms of what happened and who's been involved. And our first consideration is has there possibly been a criminal offence? If that's the case, then the police need to be informed of that, and we will decide how best to do that. And we need to do that as a priority, so that any investigation that the police may need to undertake can be done as soon as possible. Alongside that, we're also considering whether we need to make a referral for the child. So is the child at risk of significant harm, or have they suffered significant harm? In which case, do we need to make a referral for that child? The other considerations, if there isn't going to be a police investigation, there may be some support offered for the child, but there will then need to be an investigation by you as a setting. So if you're the employer, you will be undertaking the investigation in relation to what's happened through an investigatory process, possibly taking disciplinary, having a disciplinary hearing, etc. Where there isn't an employer, where we're talking about childminders more usually, then it will be Ofsted who will generally do some kind of investigation in terms of what's happened there. Again, I just emphasise to you, as soon as you have a concern, any awareness of a concern, if you think it might meet the threshold, then give us a ring. We'll be able to advise you whether it does meet the threshold. If it meets the threshold, we'll be able to advise you on next steps. If it doesn't meet the threshold, that's absolutely fine. We'll advise you of that, and you can take whatever action might be needed. It might be some additional training, some additional support in terms of taking those things forward with the member of staff to ensure that they learn and that whatever's happened doesn't happen again. Thank you. So initial considerations is it's important, and we've said it several times, but we have had a couple of occasions recently where that hasn't happened. So please report to the LADO and or phone the LADO just to take some advice from us. We're very happy to do that. Ensure that you report to Ofsted where it's appropriate to do so, and there is an online reporting form that you'll be aware of to do that. We just need to consider when the individual should be informed. In lots of cases, they will be absolutely aware of what's happened. In some cases, they may not. And therefore, if they're not aware of it, we just need to consider how and when that can be done. And again, that's really just thinking about where there might be police inquiries. So again, just take advice from us as early as possible and we can support you with that. I said before the suspension isn't automatic, and it absolutely is not. We need to consider whether the person can continue to work safely, and whether we need to move them somewhere else within your setting, for example, to work, whether they need to work supervised by somebody else, whether there's some things you don't wish them to do. And we will look at all of those with you and help make some decisions in terms of that. There are circumstances, of course, that you'll be aware where suspension will be imposed on you by Ofsted. That's not our decision. It's a decision made by Ofsted, and it will have met the threshold for their concerns to be significant, and that will be a suspension of the setting or a suspension of the childminding service. One of the things just for you to have a think about is if you are going to have an investigation, if you are required to do that, do you have the capacity in individuals within your setting who are able to do that? Where are you going to get your HR advice? Where are you going to get legal advice from, where that might be appropriate? Because my responsibility is not to do the investigation. It's the responsibility of the setting largely to do that. Do you have a management committee that can hear a disciplinary case? And just having a think through, if these situations arise, are you in a position that you can take these things forward? And I would certainly advise you to, even if you don't need it now, to know where you will get HR advice from and where you will get legal advice from, should you require to have that. Because those are going to be where it's a complicated situation, something that's really important to you. So again, as I said, we don't have an investigatory function. What we do have is the ability to support, offer advice and guidance. And we do on a regular basis liaise with Ofsted about concerns that they have and share information with them. Thank you, Hayden. So once all the investigation has been concluded, we will conclude the allegation part of it, and these are the outcomes that can apply. Firstly, substantiated sufficient evidence to prove the allegation. So these would be cases where you've perhaps given a warning, a sanction of some sort, or even dismissed the individual. That would largely be because the allegation against them has been proven. We sometimes have cases where we can't prove or disprove the allegation. One person said X has happened, somebody else said it hasn't happened. We've no corroborating evidence and no satisfactory witnesses, and we would close that as unsubstantiated. The other option we have is unfounded, which says there's no basis to support the allegation being made. We do get allegations that are false, and here we have sufficient evidence to disprove. And occasionally we get allegations that are malicious. So not only can we disprove the allegation, but we can prove that there was a deliberate act to deceive. So somebody has made something up, largely to harm the person against whom that's been made up. And we have a number of occasions where we will quite early on say it doesn't meet the criteria for our procedures. And in all these cases, we will provide you with an email outcome, so you've got an email trail of that. Just to mention to you low-level concerns, these are concerns that don't meet the threshold of harm, but maybe something that you want to take forward through your own internal practices and procedures. Just important to keep records of those, because if we continue to have low-level concerns, we're possibly getting into a territory where if those continue, a child could be harmed. So a number of low-level concerns may give us rise for concern to say actually it does now meet a threshold, because the individual is unable or unwilling to behave in a way that is acceptable to us. In terms of references, if you have a substantiated allegation, it requires to go in references going forward. So it's important the person knows that that is the case, and particularly where they haven't been dismissed, because it has implications in terms of references. And in terms of referrals to DBS, there is a statutory requirement to do that where somebody has been removed from regulated employment. Largely that would be where they have been dismissed. But if we are in cases that are significant and serious like that one, we'll be working alongside you and we'll be able to advise you when it's appropriate to make referrals to DBS. So don't be concerned about that, and we'll give you advice as appropriate at the right time. Thank you, Hayden. So I've whizzed through that because I'm really conscious it's just gone 9 o'clock and I'm sure you've had a long day and a long evening. But just really to emphasise, the procedures are on the Safeguarding Partnership website. I'm sure that's been noted a couple of times to you today. There's a whole procedures that apply to all organisations working in North Yorkshire. So it's worth you just noting where those are. On there as well as some posters and some 1-minute guides that you might want to use within your settings in terms of informing staff. Also, within the Safeguarding Partnership website, you will find our referral form that will enable you to make referrals directly to LADO. And there is our telephone number. The duty number will get one of our admin team who will be able to put you through to the duty LADO, whoever is on that day, to give you some advice. And the best advice I can give you is don't worry whether it meets the threshold or not. Don't worry if you've got a partial picture. If you think there's something that might meet the threshold, just give us a ring. We're more than happy to have a conversation, more than happy to say go back and check this out, or to say it doesn't meet the threshold, and if it does, to give you some real good support and guidance in terms of moving things forward. And certainly our experience over the years has been where settings don't make referrals to LADO, and things are then picked up by Ofsted, perhaps by the parent making a complaint. Ofsted tend to take that with difficulty, and because it's in breach of the regulations, and sometimes in those situations where that has occurred, Ofsted will come in and do an unannounced visit, and that's probably the last thing you need. So please take advice. We're happy to give it, happy to support, and hope that's been helpful for you. Does it? Yeah. No. If it meets your normal threshold for referring things to Ofsted, refer it to Ofsted. But also, if it's just a query, then no, it doesn't need to go to Ofsted. But again, if you come through to us, Gemma, we can advise you whether it does need to go to Ofsted. Low-level concerns and general queries, no. If we've got something that's going to meet a threshold for an allegation, then yes, it does need to go to Ofsted. I'm conscious I've taken a bit more of your time. Happy to take any further questions, or if not, you've got the number there. Please just drop us a line, give us a ring. We're very happy to support in whatever way we can, and hope that's been helpful to you.
Oh, thank you, Susan. Absolutely fantastic as always. I mean, I've popped in the chat the link to the Ofsted referral form. Obviously, the Safeguarding Partnership, where the managing allegations against those who work with children, where the LADO referral form is as well. And like Susan says, use the LADO duty number, because if you have just one person's telephone number, say Susan's number or Julie's number, they might be on holiday for 2 weeks. So actually the proper protocol is please just get through, go through to the duty LADO number.
We'll always be able to find somebody to talk to, don't worry.
Yeah, absolutely. So has anybody got any questions for Susan while while she's here? No question. No.
Everybody wants to go and have the tea.
Yeah, I was going to say, I think everybody's got the pajamas on and a
Or a
glass
bath
of
and
wine.
bed.
Absolutely. Well, thank you so much for joining us this evening. I hope you found it useful. And obviously I will be pushing to have another one, so I shall be using my elbows to sort of speak to the Safeguarding Partnership and ask for another one. So thank you ever so much, everybody, and have a good evening, and thank you for everything you do.